Republicans have promised to repeal Obamacare, and now the process is underway. The GOP-controlled Senate took the first big step toward dismantling President Obama's signature law last night, approving a budget measure that sets the effort in motion. As the night drew to a close, all Democrats could do was stage a protest.
This is not
debate is not allowed
as
during
usual.
a vote.
You are
Debate,
stealing health care from
debate,
Americans.
The Senate will be in order.
For all those with pre-existing conditions, I stand on prosthetic legs to vote no.
This is cruel and inhuman.
The Senate will be in order. Debate is not allowed during a vote.
Health care should not just be for the healthy and wealthy.
Senate will be in order. Debate is not allowed during a vote.
The House votes tomorrow. Here's Speaker Paul Ryan on how GOP leadership plans to proceed.
I've spoken with President-elect Trump probably 2 times in the last 3 days on this. Mike Pence was in my office yesterday to discuss this. So we are in complete sync, and we agree. We want to make sure that we move these things concurrently at the same time, repeal and replace. We need to show that there's a better way forward. We need to show that even though this law is collapsing, we can bridge ourselves to a much, much better system.
Now, Greg, you said you have a big overarching thought.
It's the first time I saw the tape of the protest, and I got to say that the goal of the protest is the hope on the left is that when you are demonized, you will lose your nerve. The moment that the left calls you mean, then you go, oh, wait a minute, maybe we should just keep things the way they are. But you got to just respond with, so what? Do not feel guilty about burning this crap to the ground, destroying this entire thing, because you have one thing to remember. It was a 2,700-page bill. No one read it. They didn't give you the time, the respect to read the bill. You don't owe them the restraint when you destroy this thing. They took your doctor. They took your health care. They took your money. It was a redistribution plan. These politicians spend more time vetting their hotel rooms, checking their mini bars, than they did on this bill. So screw them. You should feel no shame burning this bill to the ground. Sorry.
Okay, well, that's a good motto and a rallying cry.
So repeal and replace, don't worry about it. Just destroy it.
That was so exhilarating.
Thank you. No, I just was thinking about it today. I thought about because we talked about this forever, that they didn't read it. So what do we owe them for if they didn't read it?
Pelosi said that we have to read it and find out what's in it.
You pass it, and then you'll find out what's in it. And what's
passed a lot
in
of things.
Is that the idea of bending the cost curve down didn't happen. One of the things that I think is key, Kimberly, to talk about is you heard reporter ask, well, you didn't hear the reporter, but the reporter was asking Speaker Paul Ryan, are you on the House Republican side and at the new White House, the incoming president, not on the same page, because are talking about repeal and replace and the timing of it. And what I think Paul Ryan was showing there is that he and Mike Pence are very close. Yeah. Mike Pence was there yesterday. They're actually going to do something that Dick Cheney had up on the House side, which is provide an office for the vice president to be there whenever he wants to be there. So I think that what they're trying to say is that we are in lockstep. We know what we're doing, and we have a plan, and we are being mature and thoughtful about it.
I think he did that in a really great way. It was succinct. He communicated his message effectively. He gave specific examples to back it up, saying that Pence was just in his office, that he's spoken to President-elect Donald Trump out of the 3, two times, I guess, out of the past 3 days. So that shows that they are in step, that they are actually working together. They're communicating, which is what you want them to do, to be collaborative and to be on the same page so there aren't missteps early on in the administration. So it seems like, they're in unison, which I think is a very good sign, and you want to have them kind of in accord, moving forward in the same direction.
You also have, Eric, the fact that, the question that when President-elect Donald Trump said, we will do something on the same day, right? He said when HHS nominee Tom Price is confirmed, we'll have something. And I think what they're saying is that in the Obamacare bill that nobody read, there's all of these things that says the secretary shall. The secretary has the discretion. So there are so many things that, from an administrative standpoint, can be done immediately to help alleviate some of these Obamacare problems.
Yeah, and so they need to tackle a couple of things. Number one, they need to get competition back into it to really bend the cost curve down. That's the only thing that will do it. But there are 2 issues that the Obamacare failed on. It was, number one, that in order to make it work, insurers had to jack up deductibles so high that sometimes in a family, you were paying $10,000 or $15,000 out of your own pocket before you even went to the insurer to pay for a single thing. So that was the only way to keep their numbers low for the actual policies. That's a problem. They need to figure that one out by getting more competition. You bring prices down. But the other one was, the other way they had to make it work was someone had to finance this whole thing. And the people who had to finance it for it to work, because a lot of elderly people were on it, they were using a lot of the health assets and resources, young people had to buy it. And young people turned out, they realized at some point it was cheaper to take the fine on your taxes than to buy the insurance and go ahead and pay for your own insurance, and they didn't come out. So there are some economic things they need to play with, but those are certainly surmountable, and the number one way of doing that, drop the state requirements, drop the state lines, and you allow more competition into every single health care system.
One of the things that Democrats say, and like in the protest last night, is that 20 million people are about to lose their insurance, which I'm told is false. That you start the repeal place in motion, that the replace parts are in place before anybody loses their insurance, so that the Republicans are saying there isn't a gap. Nobody's going to fall through the cracks.
Gee, so if they had a plan, I'd be interested.
I have it for you.
Yeah.
And I printed it. It's called A Better Way.
Yeah, right.
No, I printed it. It's nice and it's in bullet points.
And it's fanciful.
It's a better way to fix health care.
Let me read something.
They don't like Republican ideas.
Let me read something to you that ran in the Boston Globe today. It said, Santa Claus, the Abominable Snowman, the Easter Bunny, the Loch Ness Monster, and the Republican Party replacement for Obamacare. What do all these have in common?
Everybody
they don't exist, and they never will.
Everyone believes
in them. And so he says, oh, well, gee, you know what? A lot of these young people, they just rather pay the penalty and not have to be included in Obamacare. Well, I've never thought I'd hear from you a suggestion that we hike, in fact, the penalty so that they stay in.
I didn't say that.
Well, that's the only solution.
No, it isn't.
And for you, Gregory,
hold on.
No, let me finish.
Don't put words in my mouth.
That's exactly what you said. You said it was too low.
I said the way to reduce the premium by offering competition.
Gregory, you're all about it. Nobody read it. Nobody read it.
Yes, they admit it.
No. One or two people didn't read it, and so you want to label for it. But let me just tell you, here's the thing. Right now, the polls are very clear. The Americans are divided on Obamacare. It's like 49% say repeal, 47% say keep it. But you know what's more telling? When you ask people whether or not the government should help the poor, low-income people, seniors, with health care, it's overwhelming. It's like 60+%
but no one on the Republican
say that
side,
we need to do that.
Okay, but that's a straw man, because who on the Republican side is saying that low-income, poor, or seniors should go without health insurance?
Here's the straw man for you, Dana.
But who said that?
They're all saying it because Donald Trump. Here's the man who's saying it. Repeal right now.
No, he actually said
that is not what he said.
He doesn't want anyone to have to lose their health insurance, and that's why he's pushing the
And what's the response from Republicans on Capitol Hill? We don't have a plan. We need some time.
I know, but here's the bottom line. You just made something up, and you specifically attributed a statement to the president-elect that he never made.
He did
not. He was quite specific.
We need to repeal right now. He says replace right now.
Listen,
but
he's very clear that he doesn't want anybody to fall between the gaps and to suffer and to not have any
So where's the replacement, Kimberly?
That's what they're working on.
You do understand that repealing the requirement to have Obamacare doesn't mean people lose their insurance. It means continue to ensure, just repeal the mandate that you have to have Obamacare as your insurance and work on something in place of it that people can choose
so where is it?
How many years?
Has it been 6 years? I think this passed in 2010, and Republicans in total obstruction said, oh, we can do better. 6 years later, zilch.
But wait, but they did pass it on the House. They didn't have the votes in the Senate. Now it is a whole new situation where you have enough votes in the House and the Senate if everyone stays together. And I do think that they will try to make it bipartisan. There's a really good piece on OpportunityLives.com by Jonathan Hart called "Republicans Still Need to Win Hearts and Minds on Obamacare." And I don't think that's lost on anybody, Greg. They know that they have half the country to convince.
Well, I mean, the question is, how do you counter the stereotypical counterpunch? Republicans are harming people by taking something away. You have to out-compassion them. You have to say, what system has worked with every commodity, from technology to food to transportation? The free market. The invisible hand of the free market and free enterprise beats the gnawing hand of government.
Yeah, that's the status quo, isn't it?
Here's
the status quo. Obviously, we had the free market before, and we didn't do the deal.
If you simply
we didn't. That's why the cost went up so high. The problem is the reason why it's so expensive you have in different states because they have no competition. They'll have one or maybe two people providing it, and there's 67% increases, and people are like, I can't pay for this. And then we want to penalize other people and make people buy it. This is the whole way that this is set up. It's not sustainable.
No,
they won't have the ability to be able to continue to pay for this.
Right. And what I'm saying to you is previously, before Obamacare, we had a competitive marketplace that Eric talks about, right? And what did it do? It left so many people without insurance, Kimberly.
Okay, last word to Eric.
I'm just saying there's a very easy solution to it. You repeal the mandate portion of Obamacare, even leave Obamacare as an option, and then go replace with something better. Some competition, a cheaper alternative, and Obamacare just goes on the wayside.
Where younger people could buy catastrophic insurance and not have deductibles that are impossible for them to be able to use.
You know, Fortune says this is going to cost 3 million jobs. It's going to create chaos in the health insurance market, and you guys are sitting here cheering. I just think
we're not cheering because it's going to happen gradually. Nobody's going to be left out in the cold or without medical care or proper treatment. That's the whole point of it. And by the way, it shouldn't be that hard to sell it because everybody wants better.
Yeah, I'm all for
that. And in fact,
this
document I was going to give one that I printed for him is called A Better Way. You can find it at the speaker's website. Better. Paul Ryan.
There's always recommended reading with Dana.
Well, that's why people stay and watch the show.
Lisa Simpson.
All right.